Hello, welcome everybody. We are here live on Stigma-Free Society this morning. Thanks for joining us. I know that we've had a little change in timing for the next few weeks, so thanks for being with us. It is a great day. I have an amazing guest today that I'm looking forward to chatting with. And just want to say thanks for joining us here on Wellness Chats with Nisha. I'm going to be interviewing Alicia Raimundo, who I'll introduce shortly. And we're going to be talking about the Foundry. And it's a great organization, which you'll hear all about. But before we get started, I wanted to let you know that we're going to be talking today about how things are changing in our lives, and COVID has had an impact, and so many things have had an impact. And we have a range of experiences and feelings happening for everyone. And as this is really new territory for all of us, just pay attention to how you're feeling. And if you feel like you're at risk or in crisis regarding your mental health, just know that you need to stop watching and please call 911 so that our amazing first responders can do their jobs. Thanks. So my name is Nisha. I am hosting these talks weekly, and I'm a registered clinical counselor. I have a background as a teacher. I've worked with the Ministry of Children and Family Development. I own a media company, Human Biography, where we create documentaries of fascinating people as well as commercials. And I just want to say thanks so much for being here. It's all about you and connecting with you. And so today, I would like to introduce our guest, Alicia. Here we go. Hi, Alicia.
Hi, thanks for having me.
It is our pleasure. So great to have you. Thanks for joining us. Alicia, I'm just going to do a little intro of you, okay? So,
of course, go ahead.
Always the best part, right? Take it in. You've done so many cool things. So Alicia Raimundo is a project manager at the Foundry, very cool organization, and she's working on virtual care, which I think is very big. It's a very big aspect nowadays. Alicia comes to BC with 10 years of experience building online and low barrier programming and youth engagement programs at Stella's Place, Beanbag Chat, Access, Open Minds, Ontario Youth Wellness Helps, Mental Health Assist, and Frame. Just a few places. Hey, Alicia. So Alicia has been recognized as a thought leader for their work with over 600 speeches worldwide, including the United Nations World Youth Day, TEDx, Canada's Senate, and federal government. They have also been quoted in Vanity Fair, BuzzFeed, Teen Vogue, Toronto Star, Maclean's, The Globe and Mail, National Post, The Times India, and newspapers all around the world, including Argentina, Brazil, Japan, France, and Ireland. I want to take that as my bio. So cool. What an amazing experience. And firstly, wow, way to go in getting recognized in so many different publications and areas where there's influence, where people are reading it. What do you think is drawing people to have you quoted in these things, that you are being recognized as a thought leader?
I think for me, I've always been guided by this idea that I wanted to be what I needed when I was younger, and be that adult and be that ally and create these things. I think I've been advocating for more accessible and online services for most of my career. And I think I also really wanted to share my story to help break down stigma for other people who the story resonates with. And I think that is kind of part of why I've gotten some recognition. I also think I'm really lucky to be part of a society where we've decided that stigma wasn't a thing we wanted to deal with any longer, and that we were going to break that down. And me and so many other amazing advocates breaking that down and and getting that voice in the media to help challenge that. And a couple of those more international situations happened from an event where I was able to pitch to the editors-in-chiefs of 30 newspapers from around the world. And one of the things I said to them was, I don't really care if they write about me, but I need them to write about mental health, and I need them to write about suicide in an approachable way, in a way that breaks down stigma. And I think that's, even from the ones that didn't interview me specifically or just interviewed people in their local communities, I think that was something that I was really proud of, to be able to contribute to. Let's talk about this in a productive way. Let's talk about this in a healthy way. Let's not just talk about this after something bad has happened and used it as an excuse, you know? So I've been really happy and lucky, as well as many other advocates from around the world, to start breaking down these systems and breaking down the stigma.
It's amazing because obviously, based on our name, the Stigma-Free Society, that's something we strongly believe in as well, right? Mm-hmm. That it's very important to be able to like talk about these things openly and freely, and just take away any awkwardness, because like, what's there to be awkward about? It's a conversation. We're all experiencing different things. And I feel like, thankfully, because of people like you and Andrea and Maddie who work with Stigma-Free, that we're on that path. We're on that path of changing the way we talk and changing the way we act and interact. What do you think? Are you seeing changes?
Absolutely. I think we're definitely seeing a change in the way that we talk about it when people are asking for support and asking for help. I remember growing up that I felt a lot of shame around having to ask for help, that you know, if I was a stronger person, quote unquote, I wouldn't need to ask for help. Or the other part where stigma can come in is like, oh, if I ask for help, you know, I'm too broken, they can't help me, so like, what's the point, right? And I think I'm seeing a lot of challenging of those two narratives. I remember early in my journey into this space, I always wished that people would talk about mental health the way that they talk about beating cancer, in terms of like, people are so brave and that they're so strong and that they're fighting for their, you know, ability to exist and be in this space. And I'm noticing a lot more of that, of people, you know, thanking people for having boundaries, thanking people for doing things to take care of themselves, for saying no, for reaching out for help and services, and doing all of those things. And I really enjoy that. I really hope that we continue to have a more healthy, more accepting narrative around mental health and seeking support.
I agree. I fully hope that we have that, and I enjoy seeing little pockets of it everywhere. Yeah. Why don't we talk a bit about the Foundry? So the Foundry is, it offers young people ages 12 to 24 health and wellness resources, services, and support. So it's both online and integrative services in communities throughout BC. So maybe tell us a bit about the Foundry and what you do for the organization.
Yeah, so Foundry centers across BC and also online now are serving, like you said, young people 12 to 24. We also serve their families and caregivers to be able to, if you have a young person 12 to 24 who's struggling and you want support to how to best be there for them, or that's hard for you, you know, you definitely can reach out as well. And the Foundry centers in person across BC offer, you know, the idea is that there'd be one place for a young person to go, and they would have everything they would need, from mental health, from substance use, from doctors and nurses, to any kind of social services, like help with housing, help with finding a job, those kinds of things, all in one place. And all of these people would work together and talk to each other. I think anyone who's sought services before knows sometimes you have to see a lot of different services, and sometimes you have to tell your story a lot. And I think Foundry centers and Foundry Online exists to try to reduce that, so that you tell your story once, and then the people who are going to help you along your journey are all brought in to that journey at the right time, and they know what's going on. They know whatever you're comfortable with them knowing about you. And I think that is really cool. One of the things that happened with me kind of switching from doing mostly like stigma reduction work into helping create services is that I realized that a lot of times I would go and I'd give a speech, I'd tell my story, and people would be inspired to get help. And then I'd realize there was maybe 1 or 2 places I felt comfortable encouraging people to go, and those places had wait lists. And so I really wanted to get involved with something like Foundry, especially Foundry Virtual, to be able to make sure that if somebody is going in and reducing stigma in someone else's life, that there's that pathway for when they want to get help is clear, and that there's an organization waiting there. And I think the Foundry centers and the communities that exist in online now do meet young people and families there and meet them where they're at. And for me, I was really excited to get involved with Foundry Virtual, and I have been involved with Foundry Virtual for the past year and a half of just about creating really good online resources that allow young people, that meet young people and families where they're at, so they don't have to leave their home, or they can message us from whatever secure place they have, and they get help right then, and they can do it over messaging, video, voice, phone call, and get that meet where they're at. I think a lot of people, some people may just be in a place where leaving their house feels like too much, but also a lot of people who have mental health symptoms are just really busy. They got work, they got school, they got young families. Yeah. And so being able to not have to go to the other side of town to access something makes it more accessible for them. On the flip side, there is always going to be people who want to go in person. And so to have both of those options in one organization is really awesome. And it helps me, like, for me, I was an internet kid. I still am an internet kid. So to be able to reach out for support in a place that I feel most comfortable, which is the internet, is really cool. And I'm really excited to be providing that opportunity for young people and families across BC.
I think that's huge. Even for myself, like, if I have to go to see counselor, to make the effort to go there versus if I can see my counselor online, like, it just makes things so much easier, right?
Mm-hmm.
It makes it seamless. So I think that online component, especially for the youth, like, this is like a game changer, right? Like, this is the future. This is what we need. And I also appreciate that you talked about that you offer support to families. So for people watching that may need support for their family, like, the Foundry could be a great organization for you. So it seems like a lot of work that you've done, Alicia, is around like mental health. Like, we looked at your past programs, amazing work that you've done. What inspired you to follow that career path?
I think what inspired me to follow this path was really my own personal story. And so I started struggling with my mental health when I was really young. And I remember kind of having what always felt like the wrong reactions to things. So when my fellow students were excited about a birthday party, I was scared. When people were really, really happy or stoked about something, I sometimes felt nothing and other times felt sad. And I kind of knew that there was something different, but I also knew how much my parents had sacrificed to make a life for us in Canada. I knew how hard they were working, working so much overtime, keeping us afloat and giving us a good life. And it just felt weird that even though I had all of these privileges and things that they only could have wished they had when they were growing up, that I wasn't feeling good, that I wasn't able to capitalize on it. And so I struggled with that internally a lot. And then when I tried to reach out to support from my family, they didn't really know what to say. They're coming from a culture that hadn't really spoken about mental health either. Yeah. And they really just kind of did that mentality, I think, that a lot of people are familiar with, of like, if you just smile through it, if you just work harder, it'll eventually go away. And it wasn't true for me. And I remembered thinking that the answer for me was for me not to be here anymore, which was why when I was 13, I tried to take my own life. And I'm so grateful that didn't work, that I woke up in a hospital and was able to get a second chance. But the thing for me, I remember just kind of sitting there, not sure what to do with this second chance. And then there was this fellow client in the hospital who walked up to me and like grabbed my hand very aggressively and said, from one crazy person to another, you'll need this. And she put a little necklace in my hand and she wandered away. And when I plucked my fingers from my palm, there was a necklace that had the word hope on it. And this is powerful for me because I didn't really have hope. I lived every day as a like just trying to get through the day. And so I picked things to hope for. And they say kind of for like every reason you have to not be here, you need 5 things to hope for. And so I hoped to support my family, to see my sister graduate from high school, and this sounds silly, to like see the conclusion of my favorite TV show at the time and a couple other stuff. But there was that hope that kept me going, because the waiting lists in my community were such that it would have been about 7 years. If I'd only listened to that, it would have been 7 years before a program that fit my needs would have come up. And so I was 13, it would have been since I was 20. And I know it because I stayed on those waiting lists.
Wow.
And and so I kind of wanted to go on the internet. And so I found a lot of places on the internet that were starting to talk about these things. And the reason why I really wanted to create good internet communities is because I came across a lot of bad ones and a lot of good ones, but just wanted somewhere for us to support it for people so that nobody would have that experience, and that when people, and hopefully people will be able to reach out for help before they got to the point in their journey that I was, that somebody can be there to them and can support them, even if their community doesn't understand it or their parents don't really understand it yet, and be able to hold them while the folks in their life who love them and support them work on figuring it out. So for me, that's kind of why I got into mental health, is just to make it better for myself and for the generations that follow. And for me, a large part of that is just making really good, really accessible online services, and also really helping in-person services to become accessible for the people who would like to use that as well.
Wow. So many things in there that I'd like to talk about. So first, I want to say thanks for sharing that story with us. I think that's very powerful. I think that's very real. I think that is something that a lot of people could probably say, like, hey, I saw myself in that. Yet I think so many people don't talk about that journey. So thank you for sharing it. And it's interesting when you brought up the cultural aspect, or like even looking at family. I think that's very real, that sometimes parents, families don't know what to do. And from different cultures, people handle it differently. What we're told to do exactly, like, it'll be okay, you'll be fine, just, make it through. But like you were saying, you felt like something wasn't feeling right. You weren't feeling like you're having the reactions that you see of the majority of kids around you. And I think it's hard as a child to know what to do or where to go or how to get that support. And especially, it sounds like when you even reached out for that support, that if you're on a wait list for 7 years, I don't know if that sounds like support, right? I mean, a lot can change in 7 days, let alone 7 years.
Mm-hmm.
And so now, with working with the Foundry, are you seeing this change in like the turnaround that people can access services compared to what you experienced as a child?
So Foundry Centers and our online Foundry Center also has this, is we do this thing called walk-in. So people can come in for walk-in counseling, and they'll get to see someone and talk to someone that day. Maybe they'll have to wait a little bit, but that, I think, alone is a really cool thing. I think being able to, when you feel brave, when you feel like you're going to reach out today, because we know with people with lived experience, like those things come and go. Like some days you're feeling brave, and you don't know how long that energy is going to last for. So you need to capitalize on it as soon as you can. And so being able to offer like the walk-in appointments in person or online, I think is really awesome to help people at least start on that journey, get a little bit of an action plan or whatever, what the next thing they want to try. the experiments that they want to try thinking about something differently or trying to reach out to different resources, I think is really cool. I think also having a peer support workforce really helps with this. So these are people with lived experience like me who are trained to be service providers and support people and talk about it and talk about their own experiences, but mostly listen to who they're supporting and walk alongside them. I think that has really helped us be able to see people sooner. And I think, you know, for me, part of the reason of why it would take so long for me to get support is just about being a young person who is in the LGBTQ plus community, who also lives with autism and has mental health concerns. I think those intersections sometimes make people assume that they can't help you, and so they put you on the wait list for the super specialized program. And it's sometimes my experience is sometimes I just want someone to listen to me, and I just want them to be there. And they don't have to understand everything I go through on a daily basis in intimate detail. They just have to be a good ally, a good friend. Just, you know, just listen and like maybe encourage me to check things out or support me where they can see that I need support.
Wow, that's fantastic. And so that's what it comes down to, right? I think even as parents, as community support workers, like, what is it that kids need? What is it that we need as humans? We need support. We just need someone to listen to us. We need to feel cared for, heard, seen, like we matter to someone. So it's amazing that these services are available through the Foundry. And the virtual services, so basically you just can Google Foundry contact.
Yeah, you could look up the virtual services at foundrybc.ca/virtual, and there you'll be able to see kind of some of the services we're offering right now. So we're offering counseling to young people, to family members. We have groups. Some groups are for young people, some groups are for family members and caretakers. We're going to be offering kind of you know, doctors and nurses will be on the platform soon. They're not quite there yet. We're also offering peer support to young people. So like I explained before, just people with lived experience who are there to walk alongside your journey. And yeah, so if someone is interested in, you know, what we offer on Foundry Virtual, they can go on to foundrybc.ca/virtual. We have online registration forms. The other thing they can do is they can call us at our toll-free number. And that's really cool because we have the number 1-800-FOUNDRY, 1-833-BOUNDARY, but Foundry spelled with a 0 and not an O. So the number for folks who are curious about it is 1-833-308-6379. And you can give that a call. You'll talk to one of our program assistants. And if you have questions, she can answer them. If you would like an appointment, she can book you there. If you're not a phone person and you want to fill out the online registration, you will find that on foundrybc.ca/virtual. And yeah, I really encourage people to just ask questions, reach out. If it's something that sounds like would be helpful for you, if you have questions about this being a service for someone in your life, you know, you can call the line and ask questions as well. So yeah.
Okay, great. And so, like, who are your services open to? Like, who would call into the Foundry? Like, what are the things? Like, if I'm like, I think I need to talk to someone. I don't know. Should I call the Foundry or not? How do we know?
I honestly think any young person between 12 to 24 who, you know, thinks they could benefit from somebody listening to what's going on for them and supporting them, whether they just think they want to talk to one person one time, or whether they want to talk to somebody and think about ongoing support if that's something that they want. I think anyone who's 12 to 24 who lives anywhere in BC, this is a great service for you. You don't have to worry about whether like your issue is too small or too big. We kind of want to be able to support you through whatever you're going through. And for family members, if you're taking care of a young person who's 12 to 24, and you want support about how to best be there for them, or you want to learn some skills about how to support them or how to put boundaries up, you know, that's something that that our counselors and our groups and stuff like that can help you with. And yeah, so I think sometimes people can think that their issue is too small or they're too much for something. And I would really just encourage people, if they're feeling like it might help them, to just give it a try and see how it goes for you.
I think that's great advice, because sometimes we can judge our issues, we can judge where we're at, how people might react to it. But I love that you're saying that this is for anyone.
Mm-hmm.
Anyone from age 12 to 24. If you're feeling something, if you're experiencing something, if you need someone to talk to, this is a great place to start. And then the Foundry will kind of guide you as to like where you need to go or who you need to talk to next.
Yeah, and they can definitely help. You know, if you reach out online and then what you would like is to find some resources to go to in person in your local community, they can help you find stuff like that to go to. They can connect. They can help you if you are only talking about something with us, like let's say your mental health issues or substance use, and you want to tell your GP about this. You know, that's something that folks can help with as well. And so I think it's really cool to just be able to be there. It's something that I definitely would love to have used when we were younger. And, you know, we've co-designed this entire program with young people and families from all over BC. And so it's really awesome to be doing this, knowing that they helped us create this and they're as much a creator of this as we are. And we can be able to believe in what we're doing because we got that vote of confidence from them. There's a lot of stuff that we did where they were kind of like, maybe think about it differently, or I don't think this is a good idea. And so it's really cool knowing that we worked through all of that with everyone, that we have this product now for folks to try out and see if it works for them.
It's phenomenal. I love that idea, right? That it's almost like you being in this work because of your experience and other people adding to it, that whole grassroots movement, of this is what I need and this is what's going on, and then we can create it and frame it and involve the people in the community. That's where there's so much power, right? That's where it has so much effectiveness, because then it can actually do good and make a change. What would you want youth to know if they're struggling with their mental health and they feel alone?
I think if a young person is struggling with their mental health and they're feeling alone, for me, I would want them to know that as much as strong as that feeling of being alone is, that it's not, you are not alone. There's resources like us. There's resources in your community that want to be able to be there to support you. And there's so much amazing stuff out there that want to be there for you. And I know that sometimes things can be hard to access, and I know that sometimes it does feel like you're completely alone, but I just want you to know there is community out there, folks who really want to listen, who want to support. And I also just want to say that, sometimes when we're struggling, we harp on ourselves and we think that we're weak and we think that we're not good enough. But the fact that you continue to move forward and you stay in this world with the stuff that you're struggling is so incredibly strong and brave. And I always know you want to do more or fight more, but sometimes it's okay to rest, and sometimes it's okay to just take into yourself that you are resilient because you live in the world with whatever you're going through, and just celebrate your strength as well. And if help is something that you think might be there for you, if you want someone to listen to you, reach out and get that support. I'd really encourage it.
I really want to celebrate your strength as well, Alicia, because when I look at, when you explain like where you were, right, what you went through, what you felt, the things you struggled with, and to now, me read your bio and all the different organizations you've worked with, and even like 600 speeches around the world, like that is no small task. That is huge. And all the countries that you've impacted, and even like the United Nations. I've spoken at the United Nations and I was like, this is like the biggest deal of my life. And you have like that times like so many, I've spoken here and here and here. So I think this is an amazing example and role model to the youth out there of like what you can achieve. And not that this is what everyone has to achieve. Everyone has their own path, right? Like everyone has their own path that they're to take and what they're to do in this world, but to know that there is a path for you, and whatever your dreams are, like to go for it, right? Because it looks like you you just went for it.
I think it really took people in my life, which is why I so want to encourage people to see their strength, because I think, the things you're going through, there is resilient to continue moving forward, to continue asking for help and continue asking for support. And I think it's that same strength and resilience that's helping you get through this time, even though I may feel kind of not great, is the same kind of strength and resilience that will be there for you when you want to make whatever your dream is happen, be it change the field of mental health or whatever else it may be. And that we just, and sometimes people want to do big things with their lives. Sometimes people want to go into something that's less public facing and make really big change there. And so whatever it is that they want to do, it's completely valid. And, you have that strength inside of you to go for it. And so I hope more people do. It took somebody sitting me down and showing me that living through this is a kind of expertise. It's a place I can speak from. And it's not just something of shame and guilt, but something of strength and resilience to help put myself out this way. It's actually really funny. I had a public speaking teacher in university tell me I would never be a public speaker, and just and just how much anxiety and fear I had the first time I did it, and I still have that when I speak. But I think using that to show you that this is something you should be doing and something you should be good at, and just kind of, don't let anyone discourage you from going after whatever your dream is, and whatever it is totally valid. And I did get to talk to that teacher later, and it was really funny. And I was like, so how do you feel about being wrong? But yeah, it's just kind of believe in your strength, just believe in your resilience, and go after what it is that you want to go after.
Those are beautiful words, and I think they're inspiring to everyone. So go after, first figure out what your strengths are, and then go for it, because really there's no limit in this life, as Alicia is an example of that. So I want to say thank you so much for joining us today on behalf of the Foundry, and thanks for sharing all the good work that you're doing, and just really look forward to seeing the next 10 countries that you're involved in and publications that you are quoted in. And I'm just so happy to see that it goes from someone placing a necklace of hope in your hand to you spreading hope around the world. So thanks, Alicia, for being here today. Thank you to everyone for watching. Much love to everyone out there out in the world. Know that you are not alone, that we're together, and there is support for you with Stigma-Free Society, the Foundry, people like Alicia doing good work. And see you next week, 11 a.m. Bye, Alicia. Thanks again.
Bye.